Hi, I'm Tobias Atkins, CEO of Atkins Health, and I'm super pumped to be joined here today by our resident women's health guru, exercise physiologist, and mother of 16-month-old Nicole Harnett.
Hello.
We are super excited today to be able to share with you some incredible wisdom, experiences, and journeys of some extraordinary women that we've had the opportunity of interviewing over the past few weeks.
From entrepreneurs to health professionals to business women to mothers, each of these has an inspirational story and a journey of wealth of knowledge which we hope you can take away and become a superwoman within you.
No matter where you are in life, age or demographic, we hope that this podcast shows you that you are not alone. No matter what you encounter and how hard womanhood becomes or is for you, we hope that this shows you that there is a way forward that is both prosperous, exciting, and fulfilling.
So sit tight, tune in, and be taken through our speakers' life lessons and journeys, and hopefully, if you're open to it, become a better version of you.
It's nice.
So I have to ask, coming from a bachelor's degree in accounting and business management, what drew you to the healthcare industry and more specifically to oncology and cancer treatment?
So I've always worked in healthcare. So my mother was a nurse, and back in the olden days, we used to get taken to the hospital and we'd help hand out meals and that in lunch breaks. It was many years ago. And I just always wanted to work in that industry. So I started off my career as a dental assistant and then sort of worked in different hospitals around Australia and found it was so easy just to get in and working with teams of people that cared about each other and their patients. So. And then, to be honest, I just did accounting because I love numbers. I'm just a numbers nerd, and it was either a nurse or accounting. And the only reason I chose accounting is because I didn't have the ability to do night shift with 2 young children. So that was it.
There you go. Now you've found something that's kind of almost blending both of those two careers together in some way, shape, or form. That's it.
And I really sort of fell into oncology because it was that one area. It's like, when you say something to the universe and it happens. I literally said it's one area I've never really worked in. I'd love to find out about oncology and chemotherapy in that one day and see an opportunity come up.
Next minute you're running a clinic in it.
What do you think that our relationship should be with our own health?
I think in this time and age we do get caught up a little bit with work and for women it's try and do everything, but I think we're really starting to look at the work-life balance. It's becoming I'm hearing about it more on everybody's radar. I know more businesses are looking at it. Our company itself has been looking at sharing podcasts and we've got apps on our phone to look at wellness and we have EAP sessions, and I think that for women it's I think the vital thing is actually having time for ourselves when we've got children at the same time. So, yeah.
I'm 100% hearing you on that one. Your time definitely gets diminished and everybody else gets taken over.
Nicole has a young son of her own, so she's speaking from experience with you there.
I do say to my children, you only get 10 sick days a year and that's shared between 3 of us.
Just all got to be sick on the same day.
Yeah. I love that.
On that note, if somebody is dealing with cancer, who do you think should be part of their treatment team, and what would you say, or how should their relationship be with those people?
So for a cancer diagnosis patient, they need a large team. So not only have they got their specialist who's obviously referring them, I always call the GPs the gatekeepers because people have been with their GP for 20 years. They rely on their GP to go, okay, well, this is what you've been given these options. You can go A or B. I also ask, when I employ my staff at this clinic, I also make sure that everybody has a very caring soul because I realise it's a very tender and delicate journey, this chapter of their life, and I want everybody to just surround them with love and hugs when they're here. And then now I think we're more looking at the holistic approach to cancer care. So we know that when a patient's having treatment, we want to look at the exercise they do. We want to have a look at their diet. We want to ensure that their psychological health is well. We have a lymphedema specialist. So although you're coming in here for cancer treatment, we're going to try and look after all them other things that sit on the outside that we know is either going to reduce your side effects or improve your outcomes after treatment.
I love that. To me, you're kind of explaining that, yeah, you've got cancer, and we're gonna look after that. We're gonna do our best to serve you in that respect, but we're also going to treat you as a human being and look after all the things that can kind of give you and put you in the best possible place as a human being. So that's awesome. And I must say, I do know and have met a few of your team, and you do an awesome job. They are very caring and amazing people. So hats off to you for choosing well.
Yeah, I think the emotional sort of support network is a big one as well, because it's not just the physical treatment of the disease and what you're going through there, but it's the backup in that sense as well to help move forward.
And, like there's a few support groups out in the community, but it's actually, I was just saying to a lady earlier, just making sure that our younger clientele, sometimes they want to approach the social connection via social media and not at an actual support group. So making sure we're actually meeting the needs of each of the different demographics that we're caring for as well, I think it's important.
Do you find there's different responses between the younger sort of patients to older?
I think the older, like, I'll just say, for example, for breast cancer patients, like the older ladies like to go along to the support group and have a cup of tea with, women their age. That younger support group's looking for some social media connection. Hey, who knows the best breast cream? How do I get my housework done? Has anyone got any suggestions for, we're on one wage and, can get some, it's just a different needs. I think so. I just think as cancer care providers, we need to be aware of, just meeting the different needs for each of our tumour groups and age groups.
I think that's awesome. I mean, I've actually treated a few clients who were diagnosed with breast cancer, and some of the kind of comments that they made around these kind of support groups is, whilst they're amazing, she kind of mentioned to me that you have to be in the right headspace to want to go to them, and oftentimes it can actually have in sometimes the adverse effect when the group itself, the people within it, are having those low days. Those kind of things can rub off on them. So it's interesting to see that, and really exciting to hear that you and your team, don't just, it's not a blanket rule. It's not like, hey, here's a support group, just go to that one. That's all we know of and all we have to offer. So that's really cool and really exciting to hear that, there's that individualized kind of side of things that you guys do as well. I mean, I know that, but it's good for the listeners, obviously, to hear that stuff as well.
Yeah. In saying that, how can we actually take responsibility or better charge and care of our own health? Whether that's in more of a preventative kind of manner as well?
Yeah, I think it is in a more preventative manner. So, looking at keeping our BMIs down. For me, it's keeping myself at a proper weight. It's getting some exercise. I find with a stressful job or working a lot of hours, the only thing that really sets me up for success is actually going for a run in the morning or doing something. Or, you can just get out and about. Sometimes even going for a walk in my lunch break, I found really beneficial to get through a day, to be honest. It might be just a walk to the post office and back, but that makes a big difference to the day. So that preventative health, like eating healthy, I eat very healthy every day. Not drinking as much alcohol. Like for me, I just pick one day a week. So if I've got a function midweek, I won't drink on the weekend. I pick which way it's going to go. And I think it's early diagnosis. I keep wanting to say to people, like, if you have something and it's not normal, just go with your gut instinct. Like, I think most people actually know when something's not right. I've read so many stories where people have been to the doctor and the doctor said, oh, we think it's okay, or it's just a cold, take this, and they've just had that gut feeling and, wanted to go back and make further investigation. So, yes, I think it's preventative and, looking after our health and wellness. And I think it's also just that early identification if there is something wrong, getting onto it straight away.
So
big green tick from us, by the way. That was
When it comes to probably more breast cancer specific, what age is it that sort of checks are not necessarily mandatory, but you're recommended to have your breast checked?
Yeah, I think it's over 50 to have the mammogram. But if you do have a family history, it's actually, you could go at any time. So
that seems quite late.
Yes. I went and asked for one myself, and they said, you're not old enough yet. And they said, have you got a family history? And I said, no, I actually work at a cancer centre. And that's, with my own anxiety, I think, that we just want to make sure everything fits okay. So I think if your aunt or your mother or something has, you can definitely ask and have one earlier, or if you're worried about something, I wouldn't put it off at all. But yeah, I think the mandatory ones don't think 50.
Yeah.
And do you, bit of a weird question, because I know that you guys there at Genesis Care, that you look after a variety of different clients that have been diagnosed with different types of cancers. Is there something that kind of stands out to you that, be it behavioural, be it clinical, be it anything that you find you can attribute more to the women population that you guys look after, that might be, valuable or interesting for the listeners to kind of be aware of and know?
Well, I think the people that have taken up my gym offer have been mainly women at the moment. So,
hey, there you go.
Yeah, I do think that women are more open to, do you want to see a counsellor? Do you want to have a go at the gym, or would you like to speak to a dietitian? I think some of the men are both areas, A, hesitant to go to the doctors and say, hey, this is not right, and B, actually say, well, I think it still feels blokey, because the people getting diagnosed with cancer, the majority are our older population.
Of course.
And they are the people that don't go to the doctors routinely. It's just not, it's that generation that just, they didn't go unless they were really sick, or, others are sicker than me and they'll go. So I think women are more approachable to take up offers to look at their holistic care. I think men will get there, but women are definitely there already, I think.
We're a little slow on things. You got to bear with us.